what are, in your opinion, Dr. Markham, other ways, examples, and ways to cope with mental health and really reduce the stigmas?
So you're absolutely correct. There's still quite a bit of stigma around mental health treatment. People don't understand it. So I wanted to talk a little bit about the stigma, define it a little bit, and then give the viewers some examples. So we'll just get started by defining stigma around mental health. There are a couple of different types. The first is social stigma or public stigma, and that's external, so that stems from others. Public stigma has been improved over the last decade or so, but it's only just getting better, given that until recently managed care or insurance wasn't covering it the same way as it covers medical treatment. The same is true with research. Research is funded a lot more heavily on the medical side than on the mental health side, and that's an example of public stigma. The limitations in resources and the public perceptions of people with mental health diagnoses are examples of the way stigma comes across even today in our culture. And then there's perceived or internalized stigma, which comes from within us ourselves. And it stems from our own thoughts, our own feelings about what mental health might be. And a long-term study showed that people who have this internalized shame or guilt about mental illness are less likely to do well in terms of treatment. So their outcomes are poor if they have this internalized view of stigma and that mental health is a problem. Mental health is a negative perspective. So those are some examples of how we can define it before we look at the more particular examples.